Where does our Wexner Medical Center find the great ideas that help advance our mission to improve people's lives through innovation in research, education, and patient care? Team members like Amy Leighty and Renee Grieshop are frontline staff who have been involved in making significant changes to the environment in which they work. With their radiology colleagues, Amy and Renee formed an operations council to identify areas for improvement and make positive changes that benefit our medical center, our staff, and most of all, the patients we serve.
Anyone could throw an idea out of how to change things in their department specifically, or even area over wide in radiology. Radiology is a broad area, so there's different modalities that for each council, there was a representative from each area, and we kind of just met and like once a week went over, we kind of assigned each other projects and just kind of kept up to date.
The Operations Council is very grassroots and constantly looking for ways to improve processes, streamline workflow, and reduce waste. Everyone's ideas are involved in the brainstorming for potential projects. Members are rotated in and out as projects are completed in order to be as inclusive as possible.
So we went from a barium-based product to a water-based, which means less drinking time for the patients. The water-based makes it move through the bowel quicker, so less time, a 40% decrease in time for the patient, outpatient-wise, versus 20% in the ER. Change is definitely difficult for everyone, but I think where it helped the patients and the feedback we got from patients on how great the contrast was, or just the changes that were being made, I think made it easier for everyone to adapt.
The Operations Council also identified areas within CT where workflow and IV supply use improvements could be made.
We use lots of supplies. So starting their IV for one, we have IV supplies, the saline flushes, syringes, the gloves to start the process. And then once we get in the room, when we actually do the CT, we use syringes also to inject the IV contrast. So we looked at the total volume of how many syringes that we were going through on each patient, and we realized that wasn't necessary when we could use something else. At first, everybody's kind of hesitant about changing the workflow. We all get in that same routine, but once we implemented it and went on for a few weeks, everybody loved it. All the people that were in our area, so the technologists, our lead techs, the managers, starting from the beginning, getting the patients in, so everybody that is in our workflow is involved.
Working through operations councils, our staff are creating positive changes for our Wexner Medical Center, our staff, and patients.
The Operation Council really works for us because it brings ideas in from those that are actually working every day in the environment, gives them a voice, feels like they can make the changes that maybe will make a big difference.
There is a little bit of extra work, but you can do it on the downtime. There's not like you have to go home and work on it outside of work. You can do it when you're slow at work. If there is slow time, there's an amount put away to the side where you can get off the floor and just go work on your project for an hour. It doesn't take very long.
This excellent work and leadership by individuals and teams in radiology is just one example of how we're working together to give all staff a voice and a choice of how we provide the safest and highest quality care every day.